Thanks for joining me. My name is Nathan Fowler. I'm at the MD Anderson Cancer Center, and I'm here in Switzerland at the Lugano 2019 Conference on Malignant Lymphoma, and I'm joined by Professor Chan Cheah, who's at Sir Charles Gairdner Hospital in Perth. And we just came out of a session looking at a couple different regimens, specifically lenalidomide and rituximab with CHOP chemotherapy in newly diagnosed large cell lymphoma. Interesting, in both of these randomized trials using lenalidomide and CHOP, they saw slightly different outcomes. And I was wondering if you could kind of fill us in a little bit, Chan, on why you think that is, or maybe tell us a little bit about what was the difference in the design between these two trials?
Sure, yeah. So they were interesting studies, and they were presented back to back. So the first study was called Robust, and it was a Celgene-sponsored trial presented by Umberto Vitolo from Turin in Italy.
Yeah.
So this was in patients with previously untreated diffuse large B-cell lymphoma, but only with those patients with the activated B-cell subtype, which was a key difference between the first and the second presentation. The other thing to note about this study was that there was a pretty high screen fail rate. Like about 75% of patients who were screened didn't actually end up going on study, mostly because of a large number of patients with germinal tender B-cell phenotype. So that was higher than the second study as well. Otherwise, it was a phase 3 randomized trial, and the question that was asked was, is there any benefit? And the key primary endpoint was progression-free survival in terms of the addition of lenalidomide to the R2-CHOP regimen. So the other key difference between the two trials that I thought was that the lenalidomide dose in the Robust trial was actually slightly lower. So they used 15 milligrams of lenalidomide from memory days 1 to 14, in contrast to the ECOG Akron 1412 trial where the dose was 25 milligrams. So there was actually a difference in dosage.
And there was a difference in outcome, I think, in the two trials.
There was a difference in outcome. So basically, to cut a long story short, the Robust trial was a negative study, so there was no difference in either progression-free nor overall survival between the R2-CHOP and the R2-CHOP arms.
I see.
In the subset analysis, which the study was not necessarily powered to answer, those patients with an IPI of 3 or higher, there was a non-significant trend towards benefit for the R2 arm. P was 0.09, but not significant, and it wasn't obviously designed to answer that question.
And the second trial was positive.
Second trial was positive, yeah. So that, we touched on a few differences between the first and the second study. Probably the other difference to note was that the median time to treatment in the first trial was a bit longer than the second trial, and the Mayo group have presented a few nice analyses about what happens to the outcome of patients who...
Different group of patients.
Different group of patients, right? So they're rapidly progressing, they don't get onto the study, and they may be the exact patients who benefit most from the addition of the novel therapy. So the median time sorry, go on.
No, that's it. Yeah. Well, I mean, so how does this apply? I mean, do you think, is this something you're going to adopt in your own practice, or...?
Well, me personally, no. What I'm interested in is how I think the next step is, it was a random, so the second trial, the ECOG 1412 trial, was a randomized phase 2 study, and it was a cooperative group study, and I think that the plan is to go on and validate this in a phase 3 study. The other comment to make is that the patients with GCB, diffuse large B-cell lymphoma, were also included in the ECOG study, which was interesting because the older data seem to suggest that it was the patients with ABC DLBCL who benefited most, right? But so I guess we'll see.
Yeah, so hopefully more data to come.
Absolutely.
All right, well, thank you for great opinion.
No problem.
Thanks.
Anytime.